Hello friends. Today as we're going to discuss about the practical exam part of our RGHS. So firstly, I will start today with ENT. Okay. So let me change it. So okay, see, first let me be clear. So the we have 11 subject, but for practical exams, basically, let me divide into subjects for practicals. I know all of you know it, but for sake of simplicity, I am doing this. Okay, subjects for 100 marks and subjects for 200 marks. For 200 marks, you have medicine, okay, surgery plus ortho and OBG. For 100 marks, you have ENT, ophtha and PEDS. Okay, so totally here you will get about 600 marks. Here about 900 marks. Sorry, 300 marks. So total 900 marks. So same amount of marks which are writing in theory, the same amount of marks you are competing in practical also. So today we'll discuss about ENT proper. Okay. So here let me be very clear. I am just saying the things which are there in my college, and this is what is proposed by RGHS also. So I'm just telling about that. And if you every college has their own specific modifications. For example, I cannot teach you every x-ray or instrument, because some x-rays which are there in my college might not be there in yours, or some things which are there in yours might not be there in mine. So there is an overlap, but I'm just giving you a blueprint on how the exam day goes. I'm not explaining anything much. Okay, if you have any queries, you can always DM me in the Instagram with of the link which is already there. Okay, so if we come to ENT, so how much marks you have? You have 100 marks. So firstly, broadly let us divide it into case based and non-case based. Okay. So case based here in my college, okay, in general, for case based, RGHS has told to allot 80 marks and others it's 20 marks. Okay, so now coming to the case-based thing. So what major cases which we have are, firstly we will have csom. Okay, then we have polyps, that is obviously nasal polyps. We have both intracorneal polyp and ethmoidal polyp. And third one we have is DNS. Sorry, fourth one, and last one is tonsils. So out of these five, you will get two. Okay, so make sure you prepare your examination according. And again, with different colleges, they might have different case. These are the cases which they have are probable to come. So these are the things which we are asked to focus on. Okay, these are the case, and obviously you have to go through the manuals which are there, and you have to check what are the types of question answers which they can ask. And also obviously when they are giving whenever you are answering, make sure you completely read the full sentence. Don't give a scope for asking them further questions, so that you are balanced overall. Okay, so this is the thing which is there in case based. So again, out of 2 is nothing but 40 marks and 40 marks each for each cases. Okay, that's how it goes. And remaining, coming to the non-case based section. Okay, so which is for 20 marks. Okay, this is how they have divided for us. Okay, so it is divided as viva and non-viva. Here also they can ask viva, but here what is the major focus is that they ask about x-ray and instruments. Okay, here proper theory viva. So basically this is how it goes in our college. So this is station 1, and this is station 2. Okay, so in first station, obviously this is for 5 marks and 5 marks, 5 marks and 5 marks. Okay, you will have 5 marks for X-ray and 5 marks for instruments, and again 2 other staff, that is both either external or internal, will judge you for your theory viva for 5 and 5 marks. So here again it's for 10 marks and here it's for 10 marks, again it's 20 marks. So what is the aim to pass a whole practical exam is that you should know in and out about your case. Okay, whatever kind of questions they might ask you, but you should be ready to answer any of the case. For example, it might be DNS or tonsils or polyp or csom, and all these are all these are major 10 marker questions. So here I know you will answer all your theory related stuff, but how do you take a case, how do you present actually matters a lot. Okay, so make sure a day before exam you know what are the you know how to take a case and you know how to present it as well, so that you can do that. But a day before exam is this is not and many things you cannot learn a day before exam. This you should be preparing now. Okay, this is what you should prepare now. But what you do a case before exam is that, again, these are the things which you do. Okay, again, X-rays and instruments. Again, X-rays, while giving an X-ray, for example, they might give you a X-ray of neck. Okay, yeah, I know this is not neck, but how do you start? Again, you have to introduce yourself. Again you have to start with it's a lateral neck X-ray. Again, you have to identify what are the normal anatomy part of it, and again what is the pathology you are seeing, and then you need to give a provisional diagnosis and whether it has any complications or not. When they put an X-ray, you should be able to say it for 2 minutes. I mean, at least for 1.5 minutes, where you start with view either AP or PA or lateral, then you go with what are the structures which are seen, what is the pathological finding which you can see, then what are if there are any complications which you can mention, and also other what is your provisional diagnosis or most probable diagnosis. That's how you have to keep them hooked. Okay, that's the main aim. And in instruments, again, I know there are a lot of instruments, but major instruments, what is its role? Again, by learning instruments, I know there are many videos in YouTube itself, so you can watch that. And also, every college will have their own specific though majority of the instruments are same, they will have their own specific videos which they watch. So what I would say is, again, while studying about instruments, study with its components. Okay, for example, it might have a neck or a body, tail, something like that. Then uses, then contraindicate. Where and all you don't use it. That is contraindication and extra additional uses. What does it mean? For example, this one instrument is meant to do only that, but by doing jugaad, you can also do something else. That's what nothing but extra additional things. Okay, so that's also something which you need to know. And theory Bible, you have no bounds. They can ask in and out of anything which they are interested to ask. So this is what I wanted to talk about ENT. So again, major focus would be on, again, now when you have time, so you can start studying about all this case. If you have time, you can start studying about csom, polyp, DNS, tonsils. Again, these are your 10 marker questions itself. So again, while studying that part, make sure you study in depth of it, and so that you can answer all the questions which is required, or you can watch any White Army videos also for that. Okay, then after that, again, these have your notes or have your X-rays and instruments or everything in your with you, so that a day before exam you can just watch a video or you can just discuss with your friends and you're done, and next day you can give your exams. That's what I wanted to talk with respect to ENT. I know I have not discussed much because the aim is not to explain everything here, but to know what are the things which is there in the practical schedule as such. Okay, I wish you the best. Thank you.